So the question is, how do I test for it? Meaning, how do I test for small intestinal bacterial overgrowth, or SIBO? Problem with the only other test that's available, which is a breath test, is that it has a very high false positive rate, meaning it's detecting things that aren't there, and it has a high false negative rate, meaning it's missing things that are there. So it's not a great test. The Xifaxan treatment that's recommended for it, the antibiotic, has a 45% recurrence rate. So you take it, you feel better, the symptoms come back. At this point, my practice is pretty much advanced patients who have been through 5 to 6 courses of Xifaxan or more, and that's same many breath tests. So they don't need another breath test, and they don't need another antibiotic. I listen to my patients. That's how I figure it out. I listen to their story. I want to know the story from the beginning, and I listen to that, and I'm listening for where things are happening in their body. So if someone tells me they don't feel good because they have bloating, I want to know where that bloating is. That's going to tell me where their fermentation is, and I'll know, okay, so you have this positive test for small intestinal bacterial overgrowth that's come back positive many, many times after taking a lot of different treatments for it, and you still have fermentation in your upper GI. Well, I'm automatically thinking you've got a yeast overgrowth, because if the antibiotics aren't taking care of it, and those antibiotics are strong, right? They're broad spectrum antibiotics. Xifaxan, rifaximin is a broad spectrum antibiotic. It will kill everything it gets in contact with. And then it has to regrow. The good stuff has to regrow. So over and over again, it's going to allow the yeast, just like when you take an antibiotic and you get a vaginal yeast infection, it's going to allow the yeast that's always there for everyone to eventually overgrow. So that's what I'll be thinking about. But I don't use a lot of tests because my patients have been tested and tested and tested, and they're not getting anywhere. So we try doing more of a healing and eradication, primarily based on a sulfur treatment that I developed.